I'm Italia. SaverOne series, the new generation. SaverOne for public access. SaverOne-D advanced version with ECG monitoring. SaverOne-P professional dual mode defibrillator. SaverOne series, the new generation. Confidence in saving lives. A full range of everyday defibrillators, practical to bring everywhere. Highly effective for SCA emergencies and easy to use for everybody. Lay rescuers, even without minimal training. BLS or ALS users. An emergency situation can happen to anyone, anytime and anywhere. Sudden cardiac arrest, SCA, is a condition in which the heart suddenly and unexpectedly stops beating. If this happens, blood stops flowing to the brain and other vital organs. The person affected has only a few precious minutes left for a chance of survival. Only a rapid treatment with SCA with a defibrillator can be life-saving. Your first aid and rescue could be somebody's last chance. You need to act quickly. Every minute counts. Be prepared. With the SaverOne, you'll give the victim the best chance of survival. The SaverOne New Generation is designed for public access use and licensed to administer fast and safe treatment. Highly effective, durable, and easy to operate for first responders and infrequent rescuers. The SaverOne has a comprehensive self-test system that automatically tests the electronics, battery, pads, and all internal circuits. The SaverOne performs control auto tests in different ways. During the standby mode on a daily, monthly, semi-annual basis, whenever you insert a battery in the device, activation test. The SaverOne performs a diagnostic test, activating these voice instructions.
Testing device, press shock button.
If the test is successful, activation test succeeded will be displayed on the mini LCD. This test is also performed to verify the functionality of the buttons on the keyboard and requires your assistance. 2. When you turn on the device, the SaverOne automatically performs the self-test. Startup test. If the test is successful, test succeeded will be displayed on the mini LCD screen. If the self-test detects an error, the mini LCD will display the error occurred. When someone suffers a heart attack in public, very few people know what to do and what happens. And in that situation, everyone can be a lifesaver with the help of the SaverOne. When you turn on the SaverOne, you'll be guided step by step through rescue process by clearly and comprehensive voice prompts and texts, according to the most updated AHA and ERC guidelines, thus eliminating the possibility of the device being operated incorrectly.
Stay calm and follow these voice instructions. If the patient is unresponsive and is not breathing, loosen or remove clothing to expose the bare chest and apply the electrodes. Open the package and look carefully at the picture on the electrodes. Peel electrodes from plastic liner.
SaverOne defibrillation pads are suitable for patients over 8 years old or weighing more than 25 kilos. The SaverOne pediatric pads are suitable for 1 to 8-year-olds or weighing less than 25 kilos with reduced energy. Section AED's part. The mini LCD screen always displays the level rate of the battery and runs text prompts in tandem with audible voice instructions. The display and status LEDs let you know at any time, even when the device is turned off, standby mode, the functional status of the device and its battery. The user is always prepared in an emergency situation. By pressing the I button, you can get useful device information such as serial number of the device, type of battery, number of shock delivered, current date, adult shock protocol, and you can even change the language. The SaverOne semi-automatic and fully automatic defibrillators are two dependable members of our automated external defibrillator family. The semi-automatic AED administers a defibrillating shock at the press of a button. The fully automatic AED administers a defibrillating shock when appropriate with no shock button for the user to press. The fully automatic has only 2 steps operation to respond to an SCA. Step 1. Turn on the device. Step 2.
Place the 2 electrodes firmly to bare chest as shown in the picture. Do not touch patient. Analyzing heart rhythm. Caution. shock will be delivered automatically in 5 seconds.
The semi-automatic SaverOne has a 3 simple steps operation. Step 1. Turn on the device. Step 2.
Place the 2 electrodes firmly to bare chest as shown in the picture.
Step 3. If the shock is advised, you will hear,
Do not touch patient. Analyzing heart rhythm. Stay clear of patient. Press shock button.
the AED knows when to and when not to deliver the defibrillation shock, so users don't have to worry about doing it right. The SaverOne administers an electric shock only if it determines a heart needs it. You cannot accidentally shock someone. For instance, if the device is ready to deliver a shock and it detects a positive change in the heart rhythm, it cancels the shock and you will hear
Shock cancelled.
CPR mode. SaverOne has a built-in metronome which assists the responder, indicating the proper timing of chest compressions and breaths during CPR. After shock delivery or detection of a non-shockable rhythm, the AED automatically enters in CPR mode. The voice prompt will say,
It is safe to touch the patient. Begin cardiopulmonary resuscitation now. Make 5 cycles of 30 chest compressions followed by 2 breaths. Breath. Breath.
During CPR timeout period, the AED will not interrupt the CPR mode if the patient's condition changes and the AED detects a shockable rhythm. Choose the best portability that's right for you to save lives anywhere in any public circumstance. Homes, offices, schools, hotels, airports, trains, beaches, sports facilities, discos, dentists, etc. And before the EMS team arrives. With our innovative technology, we are confident in saving lives. SCA is unpredictable, but we can be prepared. Life is a breath. Keep it safe with us. www.amitalia.com